There's a heavy stigma attached to hospice. For many, it feels like an admission of defeat, a white flag when medical options run out. But the reality on the ground is often far more chaotic. When life-limiting symptoms escalate, when someone experiences sudden, uncontrolled pain or acute respiratory distress, the home setting can quickly become overwhelmed. Exhausted caregivers suddenly face an impossible choice. They can either call an ambulance and return to a loud, impersonal hospital ward, or try to manage a high-acuity medical crisis entirely on their own. The deepest tragedy in end-of-life care is rarely the illness itself. It is the absence of a space that offers both intensive clinical intervention and the quiet comfort of a personal sanctuary. Founders Hakeem and Sade Bello built Oasis Hospice on a very specific thesis. Care should focus entirely on maximizing the quality of the days a patient has left. The priority shifts from attempting to cure a disease to comforting the human being. That philosophy took physical shape in Flossmoor, Illinois, with the construction of House of Goshen. This is not a satellite branch of a massive healthcare conglomerate. It's an independent, African-American-owned organization that has intentionally planted deep roots in the Chicago Southland. A dedicated 14-bed facility serves as a permanent commitment to the community. It functions as a physical shield, providing a level of protection for the vulnerable that home care models often struggle to match. The facility operates at a specialized tier of support known as General Inpatient Care, or GIP. This is a high-acuity level of hospice reserved strictly for symptoms that have become impossible to manage in a standard residential setting. Managing conditions like intractable nausea or terminal agitation requires immediate, expert intervention. That means 24-hour skilled nursing and the ability to perform rapid medication titration on site. This chart compares Oasis to state and national averages on core quality measures. When screening and treating pain or managing dyspnea, they consistently hit perfect 100% marks. These numbers demonstrate that complex pain management here is systematic rather than anecdotal. Yet all of these rigorous clinical metrics are achieved inside a quiet, non-institutional setting that looks and feels like a comfortable home. Clinical excellence acts as the mandatory prerequisite for comfort. Until the medical crisis is brought under control, emotional peace for the family is simply impossible to achieve. Every physical design choice at House of Goshen intentionally rejects the typical clinical feel. The layout features private suites, serenity gardens, and unrestricted visiting hours that encourage family presence. Within this space operates an interdisciplinary care team. The staff extends well beyond doctors and nurses, incorporating social workers and dedicated dietitians to address practical, everyday needs. They also utilize specialized psychosocial interventions. Programs like music and pet therapies are applied directly to help manage a patient's anxiety and distress alongside their physical symptoms. Guided by a faith-based philosophy, the staff approaches this work as a ministry. Patients and their families are integrated as active members of the care team, rather than treated as passive recipients of medical services. True holistic care requires a specific architecture, both physical and human, designed to treat the mind, the body, and the spirit simultaneously. After a patient passes, the narrative focus often stops, but the surviving family members are left to navigate a complex wave of ongoing emotional and logistical trauma. To address this, the organization established the Oasis Foundation, a dedicated mechanism for extending support well beyond the standard medical timeline. The foundation provides tangible resources directly to the community, including extended bereavement counseling and financial assistance for transportation, so grieving families can stay connected when it matters most. The actual value of a hospice provider lives in the resilience of the families they leave behind. The focus remains on how effectively a community can rebuild itself following a loss, which brings us back to that initial stigma. Entering an inpatient hospice facility is not an act of surrender. Utilizing an inpatient unit like House of Goshen early on is an active, strategic choice. It is a decision to prioritize human connection and personal dignity over prolonged suffering. By anchoring intense medical rigor within a faith-based sanctuary, Oasis Hospice offers families in the Chicago Southland a distinct, high-acuity alternative for their final journey. Clinical excellence and deep humanity can work together to create a specific kind of environment. Within these walls, families find the steady, reliable protection of a true refuge.